Hello. In this video, we will cover AccessPediatrics and all of the high-quality content available in the site to help you excel in your medical education. Once in the site, please first be sure to sign into your MyAccess profile using the sign-in feature in the upper right. Once you are signed in to your MyAccess profile, you will see your name and your institutional affiliation, which indicates that you are successfully connected to your institution's subscription to AccessPediatrics. By creating your free MyAccess profile and signing in each time you visit the site, you will gain full access to all of the features and functionalities available to you, including being able to save content to add to your favorites, view your history in case you become disconnected from the site and need to revisit an item. You can track your review questions and your case progress, and you can also edit your account information and establish email notification alerts for when new content is added to the site or updated in the site. AccessPediatrics is a comprehensive online pediatric resource that provides instant access to information essential for completing evaluation, diagnosis, and case management decisions, as well as for pursuing research or self-assessment. AccessPediatrics content is regularly updated, and the site is mobile optimized, so you can view all the content on any mobile device, same as you would on the desktop. From the homepage of AccessPediatrics, you can flip through the carousel to view some of our text resources. If you scroll, you can view the AccessPediatrics channel, providing supplemental content to the site, as well as our test question of the month and image of the month. All three tiles update regularly. And toward the bottom of the page, you can see popular chapters on AccessPediatrics among all users of the site, new content that has been added, and a snapshot of your recently viewed items in your MyAccess profile when you were signed in. Users can search a topic using the search bar. Autosuggest will appear to help guide your search. You can use the drop-down menu to the left of the search bar to search your topic by default in AccessPediatrics or by all sites to run a federated search and produce more results from across the Access medical collection. In our search results, our search terms are highlighted in yellow in each result entry. I can add an item to my favorites in my Access profile by selecting the star icon. And to the left, I can modify my search further using the search builder. I can add in additional search terms, including by keyword, title, author, or ISBN. I can filter these results by format type. I can also filter by the textbooks that are being produced in this set of results, or I can filter by topics. Under the Books tab in AccessPediatrics, users can find our nearly 50 core titles, including the landmark text Rudolph's Pediatrics, as well as other texts including Comprehensive Pediatric Hospital Medicine, the Color Atlas of Pediatrics, and Pediatric Patient Safety and Quality Improvement. All of our core titles are organized into these different categories in the table to the left for ease of access. We also include a tab for our archived textbooks for any previous editions. Our textbooks are also searchable. Any relevant features are highlighted to the right. Here we see related multimedia. Breadcrumbs across the top of each chapter help us to track our place and jump to previous or next chapters. Anywhere you see the star icon indicates you can add the content to your favorites in your MyAccess profile. The chapter taskbar across the top of the chapter enables you to jump to specific sections of the chapter, which are hyperlinked. You can print this chapter and save it as a PDF. You can also share it through email or social media, generate a citation in any of these citation styles, or use a reference management tool to generate a different citation style. Chapters are organized into 3 or more tabs, including the full chapter to include all text as well as any related figures and tables. But the figures and tables also have been broken out into their own separate tabs for ease of access. If you're assigned into your MyAccess profile, you can favorite the figure and add it to your favorites in your MyAccess profile. You can download a PowerPoint slide which includes the full citation information. You can also view the full size of this figure. Tables can be downloaded as PDFs. They can also be added to your favorites in your MyAccess profile or viewed in full size. At the top of each section of the chapter, you will notice this listen icon. This is our text-to-speech read speaker tool to enable auditory learning and to make our sites more accessible to more users.
Introduction. As pediatrics and the delivery of children's healthcare.
These settings can be adjusted, including text highlighting, highlighting options, word, sentence, and text color, enhanced text visibility, reading speed, and automatic scrolling. And if we are not sure what something is, such as enhanced text visibility, these built-in help icons will describe what that feature is. Also embedded in the textbooks on AccessPediatrics is our annotation tool called Hypothesis, seen in the upper right, indicated by the arrow. This is the annotation sidebar for Hypothesis. Hypothesis is a free but separate sign-up from your MyAccess profile. To begin annotating a text, simply highlight the portion you wish to create notes for and select the Annotate button that appears, which prompts the Hypothesis sidebar from the right side of your screen. You can see the portion of text that you were annotating, and the text pane allows you to enter in your notes. You may also use any of these text options, including to insert a link. You can set your post public or private, and you can also create private groups to share your annotations with. This is a great tool for a flipped classroom approach for instructors who wish to assign readings to their students and have them to take notes and to engage in class discussion on the assigned readings. It is also great for study groups or research groups who wish to share each other's notes. It is important to point out that all textbooks, including chapters and chapter sections, are durable URL enabled. Instructors can copy the link to any textbook, chapter, or chapter section from the browser URL and embed that in a learning management system to take students directly from the LMS course page to the content here in AccessPediatrics. The Quick Reference tab in AccessPediatrics offers practicing providers and clinical trainees excellent quick lookup clinical reference information for use at the point of care. 2-Minute Medicine is a collection of case reports covering newly published medical research that rates the level of evidence, provides a contextual overview of the article, and provides the reader with information and references to other studies or related content. It is an excellent way for pediatricians to keep up with the latest medical research in pediatrics. It is searchable, and the reports are listed by date. Also under Quick Reference, the Quick Medical Diagnosis and Treatment Text for Pediatrics covers 400 essential diseases and disorders in infants, children, and adolescents. It provides pediatricians with quick, concise answers to common clinical questions to aid both learning and clinical decision-making. It is searchable, and it can also be browsed alphabetically. The text is designed with a bulleted format to make the information easy and quick to look up at the point of care. It provides the essentials of diagnosis and general considerations, symptoms, signs, differential diagnosis, lab tests, imaging studies, diagnostic procedures, treatments including medications and therapeutics, outcomes such as prognosis, when to refer and when to admit. Also under Quick Reference is the text Clinical Guidelines in Neonatology. This text is the first neonatal handbook to focus on clinical protocols and best management practices. It provides a compilation of the most current and authoritative clinical care recommendations for the neonatal patient. The goals of this text are to help deliver effective, evidence-based neonatal care and to foster consensus in clinical practice. Readers will find it to be a comprehensive source of clinical recommendations, care paths, and guidelines to help them manage the most commonly encountered neonatal conditions. Also under Quick Reference, the TC Hospital Handbook. The Texas Children's Hospital Handbook of Pediatrics and Neonatology provides evidence-based content and concise point-of-care resources, including tables, algorithms, and clinical pearls. There are also calculations methods to assist with diagnosis and treatment. Also, we have the Philadelphia Guide. The Philadelphia Guide for Inpatient Pediatrics covers 350 of the most common medical conditions in the pediatric field. It is ideal for practitioners of all levels, from students to attending physicians, physician assistants, advanced practice nurses, pediatric nurses, and health practitioners from all disciplines involved in the care of the hospitalized child. And finally, under quick reference, included are the immunization schedules. Users can access the child immunization schedule or the catch-up immunization schedule. These immunization schedules are provided by the Centers for Disease Control and Prevention. Under the Drugs tab, we offer detailed drug data. These drugs are searchable. You can also browse alphabetically or filter by generics, trade names, or drug classes. The standard drug data includes images, pronunciation, medication safety issues, and international brand names. Users can also access clinical pharmacology data, warnings and precautions, information for pregnancy and lactation regarding this medication, dosing information by population types, general patient education information, as well as U.S. pricing information. Patient handouts are also provided in the drug monographs. These are organized alphabetically, and they include general warnings and information that a patient may be interested in knowing about the medication, such as what the drug is used for, some things to know while taking the drug, and any side effects. The drug monographs are updated every 2 weeks. Under the Multimedia tab, the Multimedia collection on AccessPediatrics offers users both procedural and conceptual videos and animations. The content here is organized in this table to the left for ease of access. The videos in this site are durable URL enabled. Instructors can copy any browser URL on any of the videos and embed in a learning management system, which is a great way to integrate multimedia content into their courses. Under the Cases tab in AccessPediatrics, we provide users with materials for short, targeted case-based learning that requires users to think critically about the content. We provide cases from our Case Files text series, as well as cases to help users prepare for board examinations and for specific skills, including symptom-based diagnosis. Cases in AccessPediatrics are also durable URL enabled. Instructors can copy the link to any case from the browser URL and embed that case in the learning management system, which is a great way to integrate case-based learning into coursework. Cases include quizzes that can be completed and the results of which can be emailed as from a student to an instructor. Users will need to be signed into their MyAccess profile to complete case content. In general, cases will include a case overview, as well as clinical information, definitions, objectives, the clinical approach, and more, clinical pearls or key takeaways, references, and comprehensive quiz. The results of this quiz can be emailed. Under review questions, users have access to thousands of review questions and answers designed to help residents, clinical trainees, and physicians to prepare for board examinations. Users can generate multiple choice questions from any of the text available. Users can test their knowledge through a random quiz, or they also have the option to customize their own quiz. Users will need to be signed into their MyAccess profile to complete quiz content. The Clerkship tab brings together all clerkship-specific resources, including text references, case files, and videos on essential concepts and procedures pediatric clerks may observe or assist in during their rotation. The Patient Education tab provides patient education handouts written at a general audience level to ensure the patient will understand the information provided. These handouts are provided in adult, medicines, and pediatric advisors in multiple different languages and as PDFs that can be customized. If signed into your MyAccess profile, users can customize this PDF handout, including adding in any specific instructions for the patient. Under the Support drop-down tab in the black ribbon along the top, users can select User Resources to go to the Access User Center, a separate website which provides additional helps and supports for engagement with Access Pediatrics. In the menu, users can jump to specific medical products, including Access Pediatrics, to find our customized help resources, including more information about MyAccess, a user guide, how to use the search layer, how to link to content, more information about Hypothesis, and much more. If you have any questions, please feel free to contact User Services. Thank you.